Okay, so actually, Kristian, you video me.
Okay.
So I managed to walk downstairs to X-ray, and I'm getting more comfortable all the time when I'm walking. So I was able to hop on the bed myself. We don't have any risk here of dislocation because the approach is anterior, and already I'm feeling like I can walk fairly normally. Now we come to the X-ray. So if I take the phone, Kristian. So obviously there's my short stem uncemented. So talk us through the bits.
Yeah, well, what is important is obviously the orientation of the implants, the components that we have inside. So what I first do is I check the overall alignment of the hip, and so we go from the teardrop figure on one side to the teardrop figure of the other side, which is basically here. So having that done now, I want to know about the orientation of the cup. So, and this is the angle which is the alternating to the one that we are looking for, because I placed it the other way around.
What are we aiming for?
Well, we want to have like 40 degrees inclination to the horizontal line. We are at 139 degrees right now, but we're looking for the alternation. So this is 41. To be honest, it in fact recreates what we measured before. It's the 41 again that we come up with.
And so what about the teeth on the?
Well, during the surgery, you see the row of teeth from the cup that stick out. So, and we anticipated that it must be like 1 or 2 rows. So exactly what you see here.
Yeah.
So now, considering limb length, we know that this is like what we have right now, 180 degrees, and refer to our horizontal that we just planned. So this resembles quite, I would say quite precisely the tip of the tuba ischiaticum. And if you transfer this line to the lesser trochs, then you see that the limb length is absolutely restored, because it's at the same, it's intersecting at the same height at both sides. So this is the upper part, that's the middle portion, that's the lower part.
And just talk us through what that hip's made of.
Well, these components being integrated into the bone are basically made of titanium. So this is solid titanium implants, or these are solid titanium implants. This is a ceramic head. And what you don't see inside here is the polyethylene liner. It's ultra high molecular cross-linked polyethylene. So it's anyhow a good liner in terms of wear and tear, because it's due to the cross-link, not that bad as it was before.
The side view,
there's the side view, perfect. It sits there like, I mean, it's made for that.
Yeah.
So, and
so are you happy?
It's the orientation of the cup.
Sorry.
Yeah, no, the orientation of the cup gives you the next guarantee for durability of this prosthesis, as we started at some 50 degrees, and the more, like over the last years, we made these, we realized that it makes sense to get them rather to 40 degrees to go off from a dysplastic implantation, let's say. So am I happy with that? Well, of course I am. The radiological result is perfect, and my patient is happy. That's the most important thing.
Absolutely amazing.